This is the fundus of the uterus. This is the uterus. This is the ovary. This is the fallopian tube. Fallopian tube is having isthmus is here, interstitial part is here, and ampulla is here. This is the infundibulum. This is the femore. This is the ovary, the ovum released from the ovary, and this is cervical canal, the cervix, uterine cavity, body of the uterus. Now, these are the the organ is having this shape and size. Now, what is this function of this your organ, this organ? So, every part is designed and to perform a specific function, and accordingly it behaves. Now, you see, now parts of the female reproductive system. Female reproductive system, internal genital organs are ovaries, uterine tubes, uterus, vagina. External genital organs are mons pubis, labia majora and minora, clitoris, vestibule, vaginal openings. And accessory sex glands, mammary glands, Skinner's glands, and Bartholin's glands. Now, ovary. Now, this is the, see, write a short note on histology of ovary. This can be a question. This can be a question, histology of ovary. 4 marks or 5 marks. Then, histological staining of a slide. That is also 5 marks or something like that. Then you go for practicals by 10 marks for your spotting of histological slides. So you can say, don't ignore anything for last this 4 months are left. I am in panic. Okay. তোমাদের ভয় পাচ্ছি না. Ovaries performs 2 major functions. Gametogenesis, production of ova, female gametes, steroid hormones, secretions, estrogen, progesterone. Ovaries are almond-shaped, pinkish white paired organs, dimension 3 centimeters in length, 1.5 centimeters in width, and 1 centimeters in thickness. Now, general structure of the ovary. Each ovary consists of the following components. Germinal epithelium. The surface of the ovary is covered by a single layer of cuboidal epithelium, germinal epithelium, viva. This can be asked in viva. Note, this epithelium does not give rise to female gametes. It's a misnomer. Tunica, albuginea. Germinal epithelium rests on the connective tissue layer called tunica, albuginea. Note, tunica albuginea of testes is much thicker than dense than that of the ovary. You seen the other day, the testes has a covering, that's tunica albuginea. And during any hydrocele, then you turn the sac, make an incision, the hydrocele fluid is come out, you take it out, and then you give a suture. Lord's operation. That is a bit thick. When you see in the dissection during your studying the testes, and ovary has a similar. Now, cortex lies beneath the tunica albuginea. It consists of various stages of ovarian follicles with oocytes, germ cells in a cellular connective tissue stroma. Stromal cells of the cortex surround the ovarian follicles and form follicular cells, corona radiata, cumulus oophoris, granular cells, theca interna, and theca external cells. Now, cortex also contains corpus luteum, corpus albicans, atretic follicles. This is important. Medulla, located in the central portion of the ovary, mainly consists of loose connective tissue and blood vessels, lymphatic vessels, and nerve fibers. Now, see, it's a flow chart. The germinal epithelium, simple cuboidal epithelium. Tunica, this can be MCQ question. Now, tunica albuginea, connective tissue coat. Cortex, ovarian follicles, follicles, atretic follicles, corpus luteum, corpus albicans. Medulla, loose connective tissue and vessels, nerves. Yeah. Now we have a beautiful slide. I'll show you in the lab. This, this is the medulla. This is the medulla, and these are the blood vessels in the medulla. You will see it in the slide there. It is like this, and take atypical, you will get. Now, this is the germinal epithelium, Tunica, Albuginea, oocytes, follicular cells, zona pellucida, granulosa cells, and choroidal radiata. Now, degenerating cells with the corpus albicans and corpus luteum. See, this is the photomicro histology ovary panoramic view at 40x H&E stain. Okay. This corpus albicans, germinal epithelium, tunica albuginea, primary follicles, medulla, cortex. Now, this is the uterus. Okay. Now, this is the uterus, the body, the cervical part, and these are the two ovaries. And you see the fallopian tube here, the fallopian tube. And you see the femoral end. Yeah, the femoral end. Okay. Now, ovary, this slide, এখানে একটা স্লাইড গন্ডগোল আছে. That slide you see, and you see the whole at 10x you see. Even if you cannot accommodate it doesn't come as a total, then you just you scan the slide 10x এ দেখে নাও, আর accordingly see, you will see the different parts and you observe and draw rough diagram. I'll just bring you, you have your own books or I'll bring 2 books, you see for it. Okay, and there's also a slide for the uterus. Now, you see different size, different this thing. Now, this is slide I opened, I cut it earlier for the earlier batches. Now, this is the uterine cavity. This is cervical part. These are all hysterectomy specimens for operation for the uterus. So, it's abnormal uterine bleeding, or see the but this had some pathology, but this is normal size, this is more or less a normal size, but this is a fibroid. Look this, even massive 13 kilo fibroid I had operated. So it can grow, but most fibroids are fibroids are not usually not malignant. Okay, now you can see the difference, and you can see the fimdia, see. This is the infundibulum. This is the ovaries. Now you just, and this is the uterine cavity. Now a portion of this tissue is taken. A portion of the ovary is taken for histology. You just correlate it. It's simple. But you have to make it a habit of seeing and this thing. Now it's not, you are not this. You just see this slide and just concentrate 10 minutes, draw, go back and see your histology textbook. You make it a habit of these 4 months, you just see, and whatever you are seeing, being today I take in the class, next week some other thing that is announced. By tomorrow it will be announced by Vijit sir. The next class ta ki hobe? To tumra to keu prostuti niye ascho na. Main jeta hoche, you have to read, just see the few pictures. Wonderful textbook. Inderpreet Singh, previously, all books, textbooks, they have accumulated from different books and made it ready. So you are getting it ready, and you just 4 months, Baba, pass kore jabe, beri jabe, forget anatomy, forget anything, but you have to do your job. তারপরে অনেকে বলছে আমি তো বুঝতে পারছি না, হ্যাঁ। The specimen of the human uterus. চলে যাও। It is the specimen of human uterus. Okay. Now you see that different size. These are more or less normal size. But this is bulky and hard because of uterine fibroids. See the irregularity and all. And this, in vaginal examination, you can feel these. That's why you have to feel, touch, smell. You have to do. Now, now this is the fallopian tube. The ovary is in the posterior aspect. This is the round ligament. Now this will be anterior to the fallopian tube. Gross anatomy te jokhon jiggesh korbe ba descriptive anatomy jokhon tomake question, you have to say this. You draw a diagram, you put a round ligament, you put a, say, in red or green, and you put in pink, you put in the fallopian tube. Ovaries you draw, and you see this is a pathological condition, but I just want to show you the difference, means in the size. Now the size is that. Now again, I had cut open earlier for your dadas and didis. This is the cut open. You can see the uterine cavity. Now this is the external os. When you do a pervaginal examination, you can feel the os. If it is nulliparous, it will be a small hole. Or cervix in a cesarean this thing, but it's not normal delivery, cesarean section. You do a vaginal examination, you see the ostium is quite big. Okay. Now internally you'll see this. Now actually when you, I told you in the lectures, anteverted, retroverted, antiflex, that is very important. And see, when you doing dilatation and curettage, DCE, evacuation, pregnancy, termination of pregnancy, or you doing an endometrial biopsy, and you have to send it for a histopathological examination. When you put a sound, it's known as sound. When you go to gynecology, you will be taught sound. But if you can feel it, that bhetore gelam, kintu kotota gelam. Because roughly you have to palpate, put a vaginal examination, and you have to gauge the length of the uterus. And you can see the external opening. With age, I think I have intolerance to formalin. I have not intolerance, I would rather say. But previously preparing specimens in the anatomy department and all, actually that was hours I used to spend. Didn't have any problem. I don't know if he washed the specimen or not properly. Rocky, I'll catch hold of him. Now, you see, now what I want to say, you put a sound, and you can feel it, that etar bhetore prothom ঢুকলো, তারপরে ওখানে ইন্টারনাল অসের যে লেভেলটা আছে সেটা তুমি ফিল করতে পারবে। Then you see, this is the uterine cavity. This is the cervix, the external os, internal os. Now you are having, now this is the anterior because of the round ligament here. This is the fallopian tube. This is the corneal end. going to the cornea of the uterus. And this is the fimbriae. Please see the slides there. Ovary is there. And also your uterus is there. Please see it. And next day I'll just revise this if you want to, or you come in groups